one social worker, an office coordinator, and then they add an RN and medical provider. The medical providers are usually a nurse practitioner or PA with an MD on staff for oversight. The school-based health center there would likely be one in the district to serve all, the entire district. And it would be open for all students, district employees, and their immediate family. They cited research that said school-based health centers decrease school absenteeism for both students and staff. They gave several examples of ways that they see the school-based health center being used in other districts. They gave an example of a student complaining of a sore throat. Like in our school, maybe if the school-based health center was in this building, if an ASA student had a sore throat, the school-based health center nurse could go to ASA, assess, and collect a throat swab, return to the health center, process the test. Results can be given to the medical provider and treatment plans discussed with the student family via a telemedicine appointment. If the strep test is negative, they return to class, or the family can decide to come pick up their child if needed. They can provide a prescription for antibiotics for the family, and so the student is able to get these services right away in the school. Another example: a teacher's child wakes up sick. The school-based health center opens at 7 a.m. The teacher arrives with their child, who may not attend our school, is assessed. They can treat. Teacher can either, if the teacher has care for their child, they can take them to that care and return to school to work while they are convalescing, or teachers can, stay home until symptoms subside. But having the school-based health center here typically minimizes employees out of work, need to be out of work to seek physician assessment. A student may meet with a social worker for counseling. The student reports not feeling well. The social worker notices. The social worker refers over to the office staff, and the student seen by the medical provider for illness, and returns to class with both needs addressed and treatment plan in place. Additionally, staff could come in to seek care and treatment plan for illness, and either mask or stay in school if they're able, so as to not miss school, but also to get their need met. There is collaboration with the school nurse. School nurses are a requirement and have to be maintained outside of the school-based health center. And there is in the MOU statements around the relationship, so that these two separate health professionals can work together. Programs. Funding is what we're meeting on Friday. Historically, PCHC has sought grants to support the startup of school-based health centers. And so I'll learn more Friday about, what they feel our chances are for securing funding. I think it was 3 years ago, there was state money for this when it was first rolled out. We called the state. There's no state money currently for school-based health centers. And so we're meeting with PCHC, and the contact is bringing along their grant writer to our meeting on Friday. I think the startup costs are for the equipment and the helping to outfit the center, not for the staffing. Students and staff would have to enroll in the school-based health center by completing some enrollment paperwork. We would learn more about that, so that that's not a barrier for access for students to be seen. So we see this as a way to increase our capacity around student mental health support in a way that is cost neutral for us, in a pretty I think efficient fashion. because they indicate that's the first and easiest services to begin. Ashley feels like, and I'll get a better indication later this week, that could be started potentially at some point later this year. So that's the update, and there is an MOU that has to be signed. Once we agree to it, I would have Drummond take a look at it for us, but really it's a pretty simple MOU that outlines like the responsibilities I just mentioned around, you know, we provide the space, they provide most of the rest. And questions?
Yeah, it sounds like good thing. I have a couple questions. So is there, I mean, like, is there pain, like, is there like family insurance involved in
Yes.
I feel like is this, how is this?
Yeah, that would be part of the enrollment process. You would provide your insurance and there, you know, we would have to learn more from PCHC about that, but it would be as if you were going to PCHC for an appointment.
So, I mean, it sounds like, I imagine like sending my kids there every day. I mean, it sounds like, I mean, it's a tremendous thing. And I wonder how much, like, how quickly it would get overrun, but like, like what's the like process for like?
Yeah, I mean, I think initially they, don't have the medical services every day and they see how the demand is going. But it's hard to get into your position, especially for illness.
Yeah.
And anything without advance, like if it's a physical or what have you. But as Ashley understood it, this really fills a need that is unmet. And any ways that it can add services, it's really beneficial, and people can know, okay, the health professional is going to be in Monday, Wednesday, Friday. You know, I need to try to access it then. The office staff, I think, would be in all week, so can set someone up for, you know, an appointment the next day if something comes up on Tuesday.
Yeah, it seems like a tremendous resource.
Yeah,
I would think it used to like
absolutely.
Yeah. We talked to the Lord that board. Just get there, take that out.
We talked to Old Town. Old Town they started last year. Brewer started 2 years ago. Yeah, I think they were the first in the region. I think they might have been the first year and got the state grant. And Bangor's were probably, I think they have 2, and one was 2 years ago and one was 1 year ago.
And those run they're running well. There's not problems with getting people into them, or
not that we have heard. But I can ask further questions on Friday about capacity.
Yeah.
I mean, just anecdotally, my wife works in the building where there's one, and if she isn't feeling well, she can get tested and get antibiotics without even missing a class. No, you know, instead of having to do the shuffle that the rest of us do. And she's never not been able to get in when she wanted to get in. I think it becomes a fixture very established.
And where were you? Do you have did you say where you were thinking the space?
I'd rather not yet.
These classrooms.
Yeah, more to come on that.
Okay. Yeah, because I guess that's one question. It's like the moving between buildings, like which building, you know, like.
Yeah,
Yeah,
I think that, you know, if it's in this complex, it sounds like either the staff would go down to test in the nurse suite down there, or it might be that someone would bring a student up here.
How would that relationship work with the school as far as like, say, for example, students not feeling like they still go to school nurse first and then they start the assessment at school nurse, say.
More than likely, yes.
And then are the parents contacted before they go?
Yes, yes, the parents would have to be, I guess we'll learn more about, once they're already enrolled, there would likely have to be a consent for them to be seen that day. because insurance would get involved. Probably the case. And then a telehealth appointment for communicating results of treatment plan.
I mean, it
Okay.
seems to me like a great idea. One risk is, kids that don't have insurance and more broadly, kids whose parents don't enroll them. I think we're going to have to think through how that doesn't become some sort of a divide that kids start to notice.
Yeah, I mean, we can ask that question. I know that our demographics would be different from these other districts, and how do they handle that in other districts? I can maybe see it as part of the back to school paperwork that we get on most every kid.
Yeah, but I guess, is there any, so, yeah, I guess, like, coverage for students that for some reason, I don't know. Do they, I'll get one question, like, for another school, they somehow support students,
I think they would see students who are not insured.
yeah.
Okay, related to this, I have a couple of staffing updates before I talk about lacrosse. I received a resignation from Ashley Guptill, our well-being coordinator. She will be finished end of next week with us for personal reasons. We're still considering next steps. I'm kind of taking over the school-based health center work to keep that ball rolling. And we're going to discuss internally kind of how we move forward in the interim, given this recent news. In addition to that, we have good news on the hiring front. We have hired for our HL payroll specialist with Sue Bell's retirement coming up in February. The individual, Michelle Mahar, starts next Monday. So she'll have a nice training phase crossover with Sue. And she has experience working in schools and familiar with ADS, and brings a background in accounting and admin assist work. Okay. Finally on my list is the lacrosse request. Our girls at Orono High School have participated on a cooperative team with Bangor High School students for the past several years. We anticipate we'll have 8 girls participating on that team this year. They have asked us, they're adding a coach due to the numbers in their program. We haven't paid anything to be a part of this program for those 3 years we've been with them. And Bangor is asking us to contribute $1,500. John Baptist is also going to contribute $1,500. That's the other team that participates in the cooperative to hire this new 3rd coach. The existing JV coach is actually moving up to be a varsity assistant. And this money that we're contributing, I think, will help hire a new JV coach. So I ask your support for that. I think, had about that many participate last year. So it's been a strong offering for us in the spring for girls at OHS. And it's a good deal to just pay $1,500 for this first time.
That's a question. So my understanding is that it's like our other cooperative teams, there's some indication that's cooperative. Whereas with Bangor, they wear Bangor uniforms and identified as Bangor teams. That's something.
I don't believe this is really a co-op.
I asked Mike, he says it's a cooperative, but it's not in the way that we are their uniforms. What is the other designation?
Yeah, it's not anything like the hockey teams
Yeah.
or swim or wrestling. And I could be wrong on this, Mike can certainly correct me, but my understanding is we have an arrangement with Bangor to accept our kids who want to play, but they are doing so, it's not a formal cooperative. And since we don't have that sport,
I specifically asked them if they said that.
I could be wrong, but I think that's still a good deal.
It's a great addition to our offerings. So, Brian, should we make a motion for that?
I was just thinking, I mean, it's $1,500. I'm sure it fits in the budget, but maybe it's better to go ahead and make a motion. I would make a motion to authorize paying Bangor $1,500 towards a lacrosse coach for Orono School high school members to participate. Is there a second?
A second.
Any discussion?
I guess I had a couple other questions. So you said it was an initial, like for $1,500, the idea that this is going to be going forward, or was there?
Likely, we just haven't had to pay anything up to this point for their participation.
Okay.
Yes,
And so, but so it'd be like $1,500 a year.
yes.
To that, and then, how many kids are on the Bangor team? Curious what the full.
It doesn't say how many total. We have 8
Okay.
participating, but it's a large team
Okay,
and they have a JV and a varsity.
yeah, I guess thinking like Meredith's point with like, should they be squaring Mario? Or is it the advertising? Like, it sounds like it's a Bangor team, but we're just like a little.
Yeah.
Idea.
How many are typically on the varsity? I was just,
I think there's 11 on the field at once.
yes, it's a pretty large roster compared
Well,
to,
given the fact that it's Bangor, perhaps and us, I would think it's probably the third in varsity and JV, probably higher.
yeah, same here. I think we're happy with the arrangement as it is, with it just being a Bangor Rams team that we can have students participate with. I've been kind of surprised that they've allowed so many to come.
Yeah, let's not, that's not a good thing.
Yeah.
We had 9 last year.
9 last year, I think this year.
Any other questions? We can go ahead and vote. Kevin,
Aye.
Jake,
Aye.
Noah,
Aye.
Mark.
Aye.
I also vote aye. Carries 5-0.
Thank you.
Anything else for your report, Meredith?
That's all.
Okay. No discussion items. We'll move to action items. I would make a motion to approve the co-curricular slate as presented. Is there a second?
Second.
Very quickly, 3 positions. Assistant varsity indoor track, Cade Wortman pending passing a shirk fingerprint test. Isabella Moore, show choir choreographer. Molly Webster, show choir music director. Any discussion or questions? We can go ahead and vote. Kevin,
Aye.
Jake,
Aye.
Noah,
Aye.
Mark.
Aye.
I also vote aye. Motion carries 5-0. You want to introduce the request for an additional ed tech, Meredith, or Lisa? I don't know who's going to do that.
Yes, I'll ask Lisa to chime in a second. So the request is for OMS specifically. A couple things are happening to cause this. We have a new student who we've received who we had to assign an ed tech, a one-to-one ed tech to. And one of our ed techs has been trained in Wilson reading, and as that has played out this year, it's pulled her away from being able to push in the same way to support students compared to the needs we see. And so the request came for an additional ed tech as, you know, things just kind of reached a boiling point of need. Do you add anything to that?
You hit it right on the head.
Okay.
It's a support in the classroom that we're missing out for some students.
And I would assume long-term, this is going to be reimbursable. We won't capture that this year, but
We
in the
have,
long run,
we have the one that is for a student that came in that needed a one-to-one. That one is immediately reimbursable.
And then the, be a part of our special ed, expenditures that will be reported to the state and reimbursable down the line.
okay. I would make a motion to authorize the addition of an ed tech at OMS for special education. Is there a second?
A second.
Any other discussion or questions? Go ahead and vote. Kevin,
Aye.
Jake,
Aye.
Noah,
Aye.
Mark?
Aye.
I also vote aye. Passes 5-0. Meredith, you want to introduce the two grants?
Sure. We've received 2 grants from the Maine Environmental Education Association. You can see them here. $1,500 for Jess Archer for her outdoor learning in the school garden, and $500 for Jen Branchflower, and I think that one is for the secret garden. Okay, for outdoor environmental education.
Great. I would make a motion to approve the 2 grants as presented. Is there a second?
Second.
In general, I would say we seem to be getting a lot more grants these days. So I would appreciate, Jess Archer is certainly a big piece of that, but a lot of other teachers are quite active too. So appreciate the efforts of the teachers on that part. Any other questions or comments? We'll go ahead and vote. Noah. Sorry, I went out of order. Yeah, thank you. Kevin,
Aye.
Jake,
Aye.
Mark.
Aye.
I also vote aye. Carries 5-0. Next up, we have cost center transfers. I can introduce it, or you can introduce it, Meredith.
You can go ahead.
We do this every year after the audit when, as you may recall, during the budget season, we put all of the contingency funds into the bucket called regular education out of the 11 buckets, because that there's a law that you can only move 5% between cost centers without a voter voting, and that's the biggest cost center. So it gives us the most flexibility to have the 5% in regular ed to move it to other places. And then when things exceed their budgeted amounts, almost always through conversations we've had here at the board at some point, we need to transfer those contingency funds into those other areas by a board vote to make it official for the auditors. So that's what we have here. I'll read the motion. I move to approve the allowable budget transfers between cost centers recommended by the auditor to remove the over expenditure in the cost centers. Decrease regular instruction by 65,853, increase system administration by 2,032, and increase debt service by 63,821. Is there a second?
Second.
Anything else you wanted to add to that, Meredith?
I would just say that the increase for system administration was due to legal fees. And the increase to debt service was due to higher than expected interest payments due to, the rejiggering of our bonds and where interest was when we did that.
Okay, excuse me, any other questions or comments? Go ahead and vote. Kevin,
Aye.
Jake,
Aye.
Noah,
Aye.
Mark.
Aye.
I also vote aye. The motion carries 5-0. Next up, we have policies. We have a revision to policy JL, student wellness. It looks like a lot of markup but it's just because the changes were kind of made wholesale. It's mostly some words here or there, so it's coming forward as just a revision. You all have a copy of it. JL is a policy required by the federal government and the school lunch program. Ben has driven the changes, and Noah has also, I believe, participated through the wellness committee. And in the policy committee, we saw a version that required a push to smarter balance standards for nutrition for food that was brought in. And we pushed back a little bit on that. So that part has been moved to encourage instead of require. But other than that, it's mostly just an update. Anything, Meredith or Noah, you want to add?
I think you got captured our conversation at the policy committee.
Okay, I would make a motion to adopt the revision to policy JL as presented. Is there a second?
Second.
Any other discussion or questions? You can go ahead and vote. Kevin,
Aye.
Jake,
Aye.
Noah,
Aye.
Mark?
Aye.
I also vote aye, carries 5-0. Into subcommittee reports, policy subcommittee met last week. Other than JL, we spent time talking about policy FF, which is naming of facilities and parts of facilities. I think we all agreed we have language about naming parts of facilities. So a ball field, a hallway, a classroom, type of thing, weight room or something. An improvement that addresses some issues that have occurred in the past, but looking at other FF policies around the country, many of them address the issue of naming a school, which is obviously kind of a whole bigger community process. And I think the policy committee was split on whether it would be beneficial to put in place a formal process for renaming a school, or the attitude of we only have 3 schools. It's not like we're a large urban district that's growing and adding schools all the time. We only have 1 school that's named after a person. So I think there were split views about whether to incorporate the idea of renaming schools in a formal fashion or not. So I think the policy committee wanted to get the sense of the rest of the board on what your druthers are on that question. And Mark, feel free to add anything you want to that too.
Also.
Anybody else have an opinion on that topic?
Wait, I guess what is the bottom line?
Well, we're definitely going to go forward with FF. That's about naming little pieces of property. The question is, but actually 2/3 of the policy as the draft is written is devoted to naming a school. If we were to change the name of Asa Adams or Orono High School or Orono Middle School, that's obviously a much more complicated process and sets forward a process of community, like we've done things with all stakeholder kind of working group and naming process, and leaves the ultimate decision to the board. But question is whether we want to have that much language there for something that's unlikely to ever happen, whether it's going to raise a question that doesn't need to be raised, whether it's going to add clarity for something that might actually happen. I guess one way to frame it is, do we think we're likely to enter the realm of naming and renaming schools in the near future?
Is there language I'm supposed to be looking at somewhere?
No, he's just talking about,
No.
it hasn't come forward yet.
Yeah, okay, so a little getting my
Yeah.
head around.
Yeah, there's no draft language. It's kind of, like I say, the language for renaming parts everybody's agreed on. There's just a question of whether the policy we have right now does not address naming schools. Other FF policies do address naming schools. It's just a question of whether we want to go there or not.
I don't know if it's worth the time and effort given the situation we're in. Like you said, we're just a small district, our 3 schools are established. can't imagine anyone wanting to change the name of any one of the three.
Given the fact that, the three board members who are not on the policy subcommittee likely haven't looked at current FF in quite some time, if ever, and haven't seen the draft that we have, would probably be, the best way forward would probably be to put the draft as it stands forward as a first read with kind of encouragement for people to compare that to the existing FF and then maybe discuss it then, because I don't think it's fair to ask
Okay,
members of something they haven't seen.
okay, we can do that. I think at one point we had said we might even have brought that forward at this meeting, but we'll just bring that, or no, I think we did say it would be in January. So we'll go ahead and bring forward the language in January and recognize we might strike the whole first 2/3 of the policy. Actually, we decided there was no meeting in didn't we just, yeah, no policy committee in January, so it'd be February. But the FF policy will come to the board in January. I'm confusing myself, but no policy committee meeting in January. FF will come in forward in January, as Mark just described. Anything from UTC?
All's quiet.
Okay. Curriculum subcommittees meeting on Thursday at 3:30. Susan's circulated an agenda. Anything from the wellness committee? Strategic plan committee, subcommittee leadership team met last week. Lots of, just like the DEI, there's sort of subcommittees trying to do work and move them forward as well. Lots of updates and ideas brought forward. It's the first time, so lots of things we're still trying to figure out too. Anything that you would add to that, Meredith or Susan?
No, I think we're just, working to get our rhythm of, subcommittees, working both, with this time with the large committee and then in between and setting priorities. So it was a good meeting to help build some momentum.
Okay, any other business? Any requests for future agenda items? Any public comment? Seeing no public comment, our next meeting is January 7th at 6 p.m. back in the library or on Zoom. Are there requests for information or follow-up? All right, I would motion to adjourn. Is there a second?
Second.
Any discussion? Seeing none. Kevin,
Aye.
Jake,
Aye.
Noah,
Aye.
Mark,
Aye.
I also vote aye. We're adjourned.
Happy holidays.